While he was getting his second injection, he also was already scheduled to see Dr. Lee. So it was pretty seamless. Dr. Lee was able to access his imaging right on the computer. He had my notes, and since I had talked to Dr. Lee, he knew what was going on and had a really good idea of what the case was all about.
I did spend some time with Chad because I do like to get to know my patients on my own. But I felt like I sort of knew him already before he walked into my clinic. And that's kind of the beauty of the system that we have with, here at the Roosevelt Bone and Joint Center, is that we have this collaborative spine effort. The treatment of spine is not strictly surgical or injections or physical therapy. It's really a broad spectrum of many treatments that can be done to help people with spine ailments. So to have sort of an all-encompassing approach for the spine here in one building is really convenient, not only for me as a physician, but most importantly for the patient.
I appreciated the fact that we were taking every measure possible prior to going into surgery with a young family and making that decision. You want to make sure your healthcare professional is taking all the precautions, and I really felt like I got that from Dr. Kaufman and from Dr. Lee.
So this is a sideways view of Chad's spine. This is the front part of his body, this is the back side. So as we go down to his spine, we see that we see his vertebrae here, and we see his discs here become a little bit darker. You can see these discs are darker, which indicates some dehydration, which is really normal for anyone. It's part of the normal aging process. As we scroll through his spine, you can see that here he's got this disc herniation, which is going back into the spinal canal. You can see this is absent at the other levels. This is how the spine is supposed to look at these levels, and you can see he has a pretty prominent disc herniation going back, pushing into the spine at what we call the L5-S1 level.
When I met with Dr. Lee, it was, he walked us through what the surgery would entail. And when he started showing us, the incision size and what he was going to do, and kind of explained what the procedure was, it wasn't what I thought it was going to be. It was much less invasive than I thought. The actual incision area was smaller than I thought it would be. So I probably went into it with a lot of preconceived ideas, but at the same time, I was amazed with his thought process on how he was going to go about fixing it.
Surgically, what we do is we make an incision right here, and we gently approach the spine, and we approach this bone here. This bone here is called the lamina, and we do a little bit of a laminotomy where we take off some of the bone and take off the underlying soft tissue to expose the spine. We gently pull the spine in this direction, and we have good exposure of the disc herniation at this level. At this point, we remove the disc herniation, and we make sure that the nerve roots and the nerve roots are free, and they're moving and they're relatively decompressed. This is a microdiscectomy, and this is what we did for Chad.
When I did go into surgery, they actually removed a section of the disc, and just instant relief. It was an amazing deal to wake up from surgery and not have any pain, especially after going through what I had gone through basically for 5 weeks prior to. So it was amazing.
A large number of people will have back pain sometime in their lifetime. There's a statistic that says that 8 out of 10 Americans will experience low back pain at some time in their life. So it can be the 20-year-old with low back pain who hurt their back during a soccer game, or an 80-year-old who's having difficulty walking in the grocery store because of their leg and back pain. And so we really aim to treat all of them.
Physicians at the University of Washington Medical Center's Bone and Joint Surgery Center use state-of-the-art research and technology to expand treatment options for spine patients.
This is a very exciting time to be in spine care. There are many new technologies emerging within spine surgery itself. Disc replacements in the lumbar spine and the cervical spine have been in use in the United States recently, longer in Europe. There are different strategies for fusing the spine, which is one of our great tools in spine. Biological care. A lot of the spine surgical approaches has been primarily biomechanical with screws and rods and fixation. We're now starting to delve into the biological treatment of spine and maintenance of discs.
One new development we have in the cervical spine is that the FDA has approved 2 new disc device, which are actually disc replacement device. If you think of the disc in between the bone above and below as a joint, this is basically a new joint. So just like patients would have a shoulder joint replaced or a knee joint replaced, we have newer technology now to actually replace the joint in the cervical spine, which is the actual disc. And the advantages of these new technology is that if you put in a disc replacement, then the patient will be able to maintain their neck motion, which is important for their function.
And people who can function without pain can get back to enjoying what's important in their lives.
Okay, ready about? Ready. Helmsley.
Jonathan Young is sailing again.
Just being out on the boat is what it's all about for most of us sailors. We always say that motor boaters are trying to get somewhere, and when we're on the boat, we're there. So this is what we enjoy.
Chad Oishi can enjoy sports with his son.
I'm glad that when I did finally have the surgery done, the results were just outstanding.
Martha Scott can perform all the strenuous farm chores that she loves to do.
Ready?
And she can play with her grandnephew Robbie again.
Oh, that's a big man. Oh, that's a big man.
I'm glad he's around, and he's bigger and I'm stronger, and I can enjoy him to the fullest extent now. So it's just really given me my life back.
Woohoo! We can ride again. Yay! Yay! Oh.
For more information, to make an appointment, or to refer a patient, contact the University of Washington Medical Center Bone and Joint Surgery Center at 206-598-4288 or on the web at www.orthop.washington.edu or www.neurosurgery.uwmedicine.org.